This is Crystal Fenn, MedPage Today, with an on-the-scene preview of the EUROECHO meeting, which kicks off this week in Budapest. I'm speaking via webcam with Dr. James Thomas of the Cleveland Clinic and President of the American Society of Echocardiography. So welcome, Dr. Thomas. This year, the meeting of the European Association of Echocardiography, EUROECHO, is changing its name to include other imaging modalities.
Yes, that's right. They recognized, as has the American Society of Echocardiography, that we're living in a multimodality world now, and that our patients really benefit when they have access not just to a single modality, but to all modalities, and that there's value in teaching about these various modalities under a single setting. The Europeans have brought this all under one tent. In the United States, there are still 4 separate societies for each of the for all the modalities, but we collaborate each year by putting on multimodality sessions at each other's meetings as they occur around the United States.
Mm-hmm. So we'll be seeing something on MRI, CT, and nuclear imaging, as well as echocardiography.
Yeah, I think that's true. That's the dominant flavor will still be echocardiography there, and just as it is in reality, the vast majority of cardiac imaging studies done worldwide are echocardiography studies.
Okay, interesting. We're seeing in interventional cardiology a move toward treatment of structural heart disease. Is that having an impact on imaging, and what might we see on that at the meeting?
There's a huge synergy between what's happening in echocardiography and what's happening in the interventional world. And I think each is driving the other. In particular, echocardiography is now called upon to provide real-time guidance for a lot of the structural heart interventions, such as aortic valve implantation, mitral valve repairs, things like that. And so we will certainly be seeing some sessions on how to guide interventional cardiology. I know that at our upcoming meeting in June for the American Society of Echo, we'll have a live case where an aortic valve is implanted from the cath lab with echo guidance. And I suspect the Europeans will have similar sessions as well.
Right. The program for EUROECHO mentioned that there'll be sessions on valvular heart disease to, sort of discuss how the risk stratification is allowing identification of asymptomatic patients who might benefit from earlier surgery. So that should be pretty interesting. Another main theme of the meeting was left ventricular function. And of course, left ventricular strain has been somewhat of a controversial topic.
Yeah, I think that's exactly right. Strain is a very promising approach to the characterization of LV function. But briefly, strain is just the percentage that the ventricle shortens during systole. So if a myocyte shortens by 20%, you would have a strain of minus 20% there. The problem has been that you can't have confidence that different vendors' instruments will give you the same value in a given patient. And so there will be some sessions discussing this problem. And also in a behind-the-scenes meeting, the American Society of Echo and the Europeans have formed a joint task force with our industry partners to really try to address this interoperability issue. And there's a lot of enthusiasm toward moving forward on this. One of the very exciting new applications of strain, though, is in patients undergoing chemotherapy. These are patients who may look like they have a normal ejection fraction from their heart, but they actually have some very subtle subclinical dysfunction that could come back to cause heart failure down the road. And for instance, at the Cleveland Clinic, we're now using strain in all of these patients to try to identify patients who may need early intervention or a reduction in their chemo dosing there. And there will be a lot of information on this at the European meeting. And also the American Society of Echo and the European Association of Echo have formed a writing group to write guidelines to help clinicians know how to evaluate left ventricular function in patients undergoing chemotherapy.
Well, that should be interesting to see how that area evolves. Thank you, Dr. Thomas. I'm Crystal Fenn, MedPage Today.